Alright, in this video we're going to explain the heart's electrical system and what happens when it goes wrong, or you have an arrhythmia or an abnormal heart rhythm. So rather than just talking to you and telling you about it, I find it really easy to demonstrate it and show you what's actually happening in your heart during normal and abnormal electrical events. So just stepping back, so you're just going to imagine my hands are the atria, so your top two chambers, and my legs are the ventricles. So basic anatomy, left atria, left ventricle, right ventricle. So during a normal heartbeat, your sinoatrial node, or your natural pacemaker, which is in the top right hand atria, will initiate a signal that will cause the atria to contract. This signal then travels down to the AV node, which is in the junction in between the atria and the ventricles, and that will delay and pause the signal for a moment, allowing the ventricles to fill up with the blood before they then contract. So it looks like atria, ventricles, atria, ventricles. So normally that's the path that the electrical signals will take. In some abnormal circumstances, so such as Supraventricular tachycardia. Tachycardia just means fast heart rate, so same signal, just a little bit faster. So if it's at rest, it means that you're looking at a rate of more than 100 beats per minute, because normal is between 60 and 100 beats. Bradycardia is at the opposite end of the spectrum, so it's when you have a really slow heartbeat, so it's less than 60 beats per minute. But just in this video, we're going to talk about supraventricular tachycardias. So tachycardia means fast heartbeat. Supraventricular means it's coming from somewhere above the ventricle. So it's either the atria or it's the AV node that's caused a bit of an issue. So the main couple of ones is your atrial flutter and your atrial fibrillation. Atrial fibrillation is probably your most common abnormal heart rhythm, and it becomes more prevalent as we age. So heart flutter we'll start off with is when the atria contract faster than the ventricles do. So there's an irritated cell somewhere that's kind of cyclically going off, so it might be 3, 2, 1, and then that one will conduct to the ventricle. So rather than being atria, ventricles, it might be atria, atria, ventricles, atria, atria, ventricles. And that's atrial flutter. On an ECG, it looks really interesting. The line in between each of the main complexes should be flat, but in atrial flutter it's a sawtooth pattern, so it's very easy to recognise. If you do have a chance to look at your own and you have been told you have heart flutter. The other one is atrial fibrillation. So instead of having a nice contraction of the atria and having one signal that will set off the contraction, there's actually multiple signals coming from everywhere trying to start the contraction. So instead of having this nice contraction, we actually get fluttering fibrillation or quivering of the atria. They don't actually contract, so they don't actually pump any blood into the ventricles, and that actually results in you losing about 30% of the blood that can be pumped out of the ventricles every time that it contracts. So instead of having this action, we have this action where everything kind of goes crazy. Every now and then, at random intervals, your ventricles will contract, or one of the signals from the chaos up top will be allowed to come down to the ventricles underneath. So this is why people with atrial fibrillation will often have an irregular heartbeat. So if you, like in the first, in last week's session, we got you to measure your heart rate. Most people will be fairly regular with their heartbeats. In people with atrial fibrillation, it'll be random, so it might be beat, 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 beat. And it's kind of, there's no regular pattern to it, like with a lot of the other either normal or abnormal rhythms. It's very random and chaotic and all over the place. So there is a risk with that. If you have this fluttering up here and no actual contractions, what can happen is blood can start to pool up in little corners of the atria and start to form a little clot. The issue then is if that clot then just lodges, goes down to the ventricles and then up to the rest of the body, if it finds its way to a location in a smaller blood vessel and block it off, it can cause issues. So if you have a block somewhere in your brain, it can cause a stroke. So this is really a very real consequence of having atrial fibrillation. So a lot of people might, it's not that big a deal. You may or may not have symptoms with the atrial fibrillation, but if you do develop a blood clot and it dislodges and then finds its way up to your brain, it can cause a stroke. So if you do have atrial fibrillation, chances are you'll be on some sort of anticoagulant or blood thinner, and we'll go into those next week. The other one, so you may be in atrial fibrillation all the time, which is persistent atrial fibrillation, or you may have paroxysmal SVT, which means every now and then you'll flick into one of these high SVT rhythms, and then you flick back out of them. You may have a regular trigger or you may not, but you flick in and out of these rhythms, and that's when this contracting and quivering might alternate. If you have atrial fibrillation, you're flicking in and out of it, and that's really where the issue comes with blood clots and them dislodging. If you have quivering and then all of a sudden you contract and pump all that blood out, it's more likely to expel that clot throughout the rest of your body. So that's it for abnormal heart rhythms and SVT. Hopefully you got a little bit out of my dancing style, and it makes it a bit more clear about what's actually happening in your body or in your heart if you have any of these abnormal heart rhythms.